If you're here, you're likely seeking hope either for yourself or someone you care about. The journey to recovery from addiction is challenging, but you're not alone. Addiction isn't a moral failing, it's a complex health condition that affects the brain and behavior. For too long, stigma and shame have kept people from seeking help. We must shift our perspective and treat addiction as a medical issue, just like any other chronic illness. This change allows people to seek help without fear of judgment. For those struggling, it means letting go of self-blame and seeking professional support. For loved ones, it means offering informed, compassionate support, not judgment. Recovery is a collective journey, built on empathy and education. We'll explore what science tells us about addiction and the most effective ways to treat it. The path isn't always easy, but healing is possible. Recovery is real, and your story can be one of resilience and transformation. Welcome to a new hopeful chapter. To treat addiction, we must first understand it. Addiction is a chronic brain disease, not a simple choice. Drugs hijack the brain's reward system, making quitting incredibly difficult without help. Over time, the brain adapts and the drug becomes necessary just to feel normal. This is why people continue using despite knowing the harm. Think of addiction like diabetes. It's not a choice, and it requires ongoing care. Setbacks aren't failures, they're part of managing a chronic condition. Addiction, like other illnesses, is influenced by genetics, environment, and development. Telling someone to just use willpower is as unhelpful as telling someone with asthma to just breathe. Compassionate, evidence-based treatment is essential. Recognizing addiction as a treatable disease is the first step to real solutions. With the right support, recovery is possible. Let's move forward with understanding and hope. There's no one-size-fits-all solution for addiction. Each person's path into and out of addiction is unique. Effective treatment is personalized, addressing both substance use and overall well-being. Professionals assess factors like drug of choice, addiction severity, and mental health needs. Treatment plans may include medical care, therapy, and practical support. A variety of evidence-based options exist, empowering people to find what works for them. Recovery plans should evolve as needs change. For families, support means encouraging exploration and flexibility. The goal is a sustainable, individualized path to recovery. Personalized care is the cornerstone of effective treatment. Effective treatment starts with proven methods. Detox is often the first step, especially for substances like alcohol or opioids. Medically supervised detox ensures safety and comfort. Once stable, behavioral therapies like cognitive behavioral therapy help change patterns and build coping skills. Motivational interviewing and contingency management offer additional support. Medication-assisted treatment combines therapy with medications to reduce cravings and withdrawal. These are legitimate medical treatments, not substitutes. Community and peer support, through groups like AA or secular alternatives, provide connection and encouragement. Treatment settings range from inpatient rehab to outpatient care, depending on individual needs. The right mix of therapy, medical care, and support creates a strong foundation for recovery. Recovery is built step by step, with the right tools and support. Lasting recovery means treating more than just substance use. Addiction often coexists with mental health issues, trauma, or life skill deficits. Integrated treatment addresses all these factors together. Ignoring mental health is like fixing a roof, but ignoring the foundation. Treatment helps people develop coping skills, routines, and practical life tools. Addressing trauma through specialized therapy is crucial for many. Recovery is about building a new identity and finding purpose. It's about reconnecting with passions, relationships, and community. When treatment focuses on the whole person, sobriety becomes a natural outcome. A fulfilling life is the best defense against relapse. Setbacks can happen in recovery, but relapse is not failure. Addiction is a chronic disease, and relapse signals a need to adjust the treatment plan. Just as with diabetes or asthma, setbacks are part of long-term management. Relapse is a chance to learn and strengthen recovery, not a reason for shame. Compassion and support are vital when setbacks occur. The focus should be on quickly re-engaging with treatment and identifying triggers. Progress isn't erased by relapse. Every step in recovery counts. Experience gained helps people move forward with greater insight. Recovery is a journey, not a straight line. With renewed support, people can get back on track. Hope and persistence make long-term recovery possible. Recovery is a journey of transformation and resilience. Millions live full, joyful lives in long-term recovery. Ongoing support is key. Recovery is a lifelong commitment, not a quick fix. Stay connected to support networks and keep practicing healthy coping skills. If you're starting out, be patient and celebrate small victories. If you're supporting someone, offer compassion and encouragement. Every step forward matters. You're not alone, help and community are always available. A life free from addiction is possible, filled with freedom and connection. The work is hard, but the rewards are immense. Hold on to hope, it fuels the journey. Your next chapter can be one of health, healing, and hope. Follow us on TikTok at Recovery, Journey33, Instagram at Recovery, Journey33, and Recovery, Journey on Rumble for more contents like this. See you on the next one.